Hello everyone, welcome to the series of GPAT MCQ. Today's topic for discussion is tablet and coating. This is first question. CAP stands for option A, cellulose acetate phthalate, option B, cellulose acetate potassium, option C, carboxyacetate phthalate, option D, carboxyaryl phthalate. So the correct answer is option A, cellulose acetate. So cap is commonly used polymer phthalate in the formulation of pharmaceuticals such as the enteric coating of a tablet or capsule, and it is used for control release formulation. Why it is used for control release formulation? Because there are certain medications which get destroyed at the acidic pH present in the stomach. So we have to create acid resistant tablet, and so we are using a coating on that tablet to prevent it from getting degradation. So basically the common polymer is CAP, that is cellulose acetate phthalate. As you can see in the slide, the polymer is present, the structure of polymer is present, where you can see that the free carboxylic acid remains in the polymer, and because of free acidic functionality, it is deprotonated at basic pH. So we all know that the enteric stands for enteron, that is intestine, which has a basic pH, and while our stomach has the acidic pH. So basically, that uh, it is being acid resistant tablet, and it is going to release its active pharmaceutical ingredient into the stomach. Next question. Thickness for the film coating varies from option A 1 to 10 nanometer, option B 20 to 100 nanometer, option C 2 to 50 nanometer, option D none of the above. Correct answer for given question is option B, that is 20 to 100 nanometer. So we have to remember that की thickness varies from 20 to 100 nanometer. Basically क्या होता है कि there are certain things जहाँ पे हमें thickness, उनका diameter, ये सारे range या values याद रखने पड़ते हैं. For example, dispersion में होगा तो coarse dispersion, molecular dispersion, तो सबकी range या values है ना याद रखने पड़ते हैं because they are very much important for GPAT purpose. Question 3. Baffles and diffuser are associated with option A, Pellegrini, option B, immersion sword, option C, immersion tube, option D, all of the above. The correct answer for given question is option A, Pellegrini equipment. Pellegrini pan system with baffle and diffuser, which allow the distribution of drying air uniformly through the tablet bed or pilot. The various type of tablet coating machines are available in the market based on these three principal types. First one is standard coating pan. So Pellegrini pan is a type of standard coating pan. यहाँ पे modification इसके लिए होता है to get the better quality of the tablet, to get better manufacturing. We have modified it into immersion sword system, immersion tube system. The second one is perforated coating pan, which include acela coater, high coater system, dry coater, etc. And the third one is fluidized bed or air suspension coater. So coating के लिए we need equipment, and here is the list of equipment which require for the coating. Next question, which grade of HPMC is used for enteric coating? Option A 50, option B 55, option C 50S, option D 55S. The correct answer is option B 55. The substance used in an enteric coating are HPMCP, that is hydroxypropyl methyl cellulose phthalate. It is a polymer which exists in various grades like HPMC 50, 55, 55S. This polymer dissolves at low pH around 5 to 5.5. HPNCP 55 is generally used for enteric preparation. They are stable than cap because they lack the acetate group. Question, which of the eudragates are pH independent? Option A, L and S. Option B, RL and RS. Option C, all of the above. Option D, none of the above. So the correct answer for given question is option B, RL and RS. Eudragates are polymethacrylate polymer prepared by the polymerization of acrylic and methacrylic acid or their esters. Eudragate L and S are both resin produced film which are resistant to gastric fluid. They get dissolved at a pH of 6 and 7 respectively. As we know that कि ये polymer है तो वो acid resistant होगा, so dissolve होगा 6 to 7 pH पे. So it will not get dissolved at stomach at like acidic pH, और वहाँ पे अपना medication release नहीं होगा. So it indicates that L and S are completely pH dependent. So vice versa, RL and RS are pH independent polymer. So you have to remember that कि यूड्रैगेट में बहुत सारे types होते हैं, that is L, S, RL, RS. So these types are very much important and they can be asked in any form. They can be asked in any form in examination. So here is the structure of यूड्रैगेट polymer. So वहाँ पे हम देख सकते हैं क्लियर कट कि R1, R2, R3, R4 यहाँ पे R1, R2, R3, 4 तो जहाँ पे वो इंडिकेट करता है कि वहाँ पे अगर वो फंक्शनैलिटी प्रेजेंट होगी देन इट विल बी ग्रेड ई. अगर CH3 है तो वो E है R1. अगर CH3 के बाद H है फिर CH3 है तो RL RS. वैसे हर एक फंक्शनैलिटी ग्रुप डिफर करते हैं डिफरेंट ग्रेड को बेसिकली. तो वो एक कॉमन स्ट्रक्चर है पॉलीमर एंड उसमें जो मॉडिफिकेशन होगी उसके हिसाब से यूड्रैगेट के ग्रेड जनरेट होते हैं. Next question, plasticizer is added in a coating to option A, enhance the color, option B, improve the fragrance, option C, improve the quality of the film, option D, all of the above. So the correct answer is option C, improve the quality of the film. Plasticizers are used mainly for oral solid dosage form. Plasticizers are added to the polymer which used as a film forming agent in order to make the polymer pliable, soft, enhancing its flexibility and improve the plasticity of the film. The commonly used plasticizers can be categorized into three major groups, that is polyols, organic esters, oil, glycerols. Polyols में आता है option A glycerol, glycerin, B propylene glycol. We all know that कि glycols कितने commonly used plasticizers होते हैं. तो polyethylene glycol, that is PEG. Generally the 200-600 grades is used. Organic esters में आता है phthalate esters, dibutyl sebacet, triacetine, citrate esters, etc. Oils और glycerids में आते हैं castor oil, acylated monoglycerides, fractionated coconut oil, etc. Next question is opaque spray. Opaque spray is used for option A, film coating, option B, sugar coating, option C, both, option D, none. The correct answer for given question is option A, film coating. Opaque spray is a chemical compound used in the film coating of a tablet as a coloring agent, and opaque dye is used for complete film forming concentrate. So you have to remember this point कि किसके लिए किसका यूज क्या है और कैसे मतलब कहाँ पे यूज होता है. तो बेसिकली blooming defect can be prevented by option A, controlling the temperature and humidity. Option B, monitoring the content of the coating. Option C, overwetting. Option D, all of the above. The correct answer is option A, controlling the temperature and humidity. So let's understand what is the blooming effect. Blooming is defined as the fading or dulling of the tablet color after a prolonged period of a storage at a high temperature. Like as we see, मतलब we have seen at our home कि tablet एक period के बाद उसका color कभी dull होने लगता है. So this is the blooming effect basically, and which is very one of the common effect in a tablet manufacturing. So here you can see on the screen that the original tablet is orange and after blooming it has become slightly light in nature, that is similar to yellowish orange. So that is the blooming effect. Let's understand the cause. High temperature during formulation can cause blooming. Exposure to high humidity conditions. अगर humidity environment में रहेगी तो it may react with the outer layer of tablet, and that is the reason the dulling of tablet is taking place. So remedies are we have to monitor the temperature, मतलब एक control temperature और control humidity conditions में the tablet should be manufactured to prevent such defect, and defected tablets are always discarded. Next question, defect common to both tablets and tablet coating. Option A, sticking and picking. Option B, orange peel effect. Option C, blistering. Option D, all of the above. So the correct answer is option A, sticking and picking. Let's understand the solution in detail. Sticking. It is a defect where isolated areas of film are pulled away from the surface when the tablets stick together and then part. So basically the name itself indicates that the two tablets are going to stick to each other. Common है कि sticking और picking से हमें समझ आता है कि sticking में they are going to stick, while picking में the outer layer might get picked because of sticking of another tablet. So picking is defined as this does not occur alone. It must have another tablet to be stuck with, which called sticking. So because of sticking of two tablets, the outer layer of another tablet is getting picked out, and that's the effect known as picking. And this effect are both common in tablet coating as well as tablet manufacturing. Like you can understand while coating the layer, the outer layer while coating basically. If the drying is not properly, then my two tablets get stick while transporting, while handling, while packaging. Anything can happen. So before marketing, before launching the medication in the market, we have to check the all quality control parameters. The cause of sticking and picking, let's understand. Higher rate of application of a coating solution. Because of excessive coating solution, there might be chances of sticking of two tablets to each other. Inefficient drying. If the drying is not properly, and that is the reason the outer layer is not getting dry properly, and the tablets are sticking to each other. So the remedies for sticking and picking is use optimal and efficient drying conditions. एक proper drying condition होनी चाहिए so that this defect will be prevented, and increase the inlet air temperature. As we all know that higher temperature पे ज़्यादा अच्छी drying होगी, so that we can increase the inlet air temperature to prevent from sticking and picking. Decrease the rate of application of a coating solution by increasing the viscosity of a coating solution. तो जो rate of application है coating का, उसको हम कर सकते हैं कम कर सकते हैं by increasing the viscosity of a coating solution. So that is the remedies and cause of sticking and picking. Let's move to the next question. Disintegration time of the effervescent tablet is option A 15 minutes, option B 30 minutes, option C 3 minutes, option D 2 hours. The correct answer for given question is option C 3 minutes. So for this solution, I have added this table so that तुम सारे tablets और उसके as per IP, as per BP, as per USP कितना standard time require होता है disintegration के लिए, dissolve होने के लिए, वो I have mentioned in this table. So you have to remember almost all of the tablet and their time. As we know that कि effervescent tablet मतलब वो carbonated हो गए तो वो जैसे like as we know effervescent granules like ENO, तो वैसे effervescent tablet में aspirin वगैरह आते हैं और जो इफेक्टिव तुरंत डिसइंटीग्रेशन होगा तो if you will get instant therapeutic effectiveness. As we all know that कि अगर शुगर कोटेड टैबलेट है तो उसको डिसइंटीग्रेट डिजॉल्व होने को टाइम लगेगा कंपैरेटिव टू effervescent tablet. So basically let's understand one by one. Standard compressed tablet requires 15 minutes uncoated. For example, crocin, sugar coated tablet 60 minutes. Basically supplements tablet. Film coated tablets are 30 minutes. The enteric coated one requires 1 hour. The effervescent tablet requires less than 3 minutes. So कैसा होता है कि हर एक के अपने अपने पैरामीटर्स होते हैं, तो we have to remember according to the Indian pharmacopoeia, British pharmacopoeia, United States pharmacopoeia, and the oral dispersible tablet requires less than 1 minute. So the next question is high plasma protein binding. Option A makes the drug long acting. Option B increases the volume of distribution. Option C minimize the drug interaction. Option D facilitates the glomerular filtration of the drug. So the correct answer is option A, which makes the drug long acting. Let's understand the solution. High plasma protein binding may also have an impact on the efficacy, and it is usually the free fraction of drug that is responsible for the pharmacological action. Always remember that key, for example, phenotine, which has a 99% of binding. So 99% of a drug will bind to plasma proteins, and 1% remaining is responsible for your pharmacological action. So for example, मतलब let's understand कि अगर मैं 10 मिलीग्राम अगर उसका है तो मस्ट दैट, तो इसका मतलब ये नहीं है कि 10 मिलीग्राम पूरा का पूरा हमें एक्शन दे रहा है. हाँ, जो fraction freely available होगा rather than the plasma protein binding, that will be responsible only for the pharmacological action. So compounds that are extensively bound to the plasma protein will have low volume of distribution and can have long plasma half-life. अभी अगर half life इसकी ज्यादा है, that is T half अगर उसके बहुत ज्यादा है, तो obviously it indicate तो इसका तो duration of action ज्यादा होगा. And अगर वो strongly bind करता है तो it will have a low clearance, common sense, by both hepatic as well as renal route. So basically high plasma protein binding is responsible for the longer duration of action. Next question is the first stage of addition of granulating agent to the powder is characterized by which of the following? Option A, pendular stage. Option B, funicular stage. Option C, droplet stage. Option D, capillary stage. So the correct answer for the given question is pendular stage. So in this So in this slide, you can see that the granulation का process का मैंने सारे stages add किया है. What is pendular, funicular, capillary, droplet. So always remember that the droplet stage is not required and not desirable procedure. Let's understand one by one all the stages. Pendular stages. This is the initial stage just after the addition of a binding agent. Funicular stage. This is the second stage where the adequate binding solution incorporated between the particles. So you can notice that in the सो यहाँ पे तुम लोग देख सकते हो कि कैसे यहाँ पे पेंडुलर में बस ये जो ग्रैन्यूल्स है बाकी कुछ नहीं है उसमें उनके बीच में ये व्हाइट व्हाइट स्पेस है एंड व्हाइल इन अ फ्यूनिकुलर यू कैन नोटिस दैट while in funicular you can notice that कि ये जो adequate solution है binding solution वो release हो चुका है granulation में and वो जो dark part है वो solution है while in capillary stage in this stage the binding solution interrupt by the capillary action you can see that capillary action की वजह से सारे particles है वो एक दूसरे को bind हो चुके हैं अच्छे से and the last one is droplet stage here overweighting take place and particle uh, एक बड़ा सा बन सकता है विच इज नॉट अ डिजायरेबल स्टेज सो बेसिकली ये सैचुरेशन यहाँ पे लोगों ने दिखा है कि अभी एक्सेसिव हो चुका है तो 100% होगा एंड द अचीव रिक्वायरमेंट इज अवर कैपिलरी स्टेज द अचीव the required stage is capillary stage basically. So the next question in the tablet coating process, inadequate spreading of the coating solution before drying causes option A sticking, option B blistering, option C mottling, option D orange peel effect. The correct answer is option D orange peel effect. Let's understand the solution. Orange peel effect is defined as an inadequate spreading of a coating solution. The cause is rapid drying and high viscosity of a coating solution. Remedies decrease the rate of drying, decrease the viscosity by adding the solvent. So commonly it can understandable that is inadequate spreading of a coating solution. यहाँ पे आप देख सकते हैं कि कैसे inadequate spreading हुआ है जिसके वजह से proper coating नहीं हुआ. So defective tablets are always discarded. So the next question is artificial sweeteners are option A sucrose, option B mannitol, option C saccharin, option D all of the above. So the correct answer is option C saccharin is an artificial sweetener. The FDA has approved 5 artificial sweeteners for the consumption as sulfame K, aspartame, neotame, saccharin and sucralose while the rest are natural. Next question, which of the following is a granulator with a drying facility inbuilt? Option A, Diasna, option B, Topo, option C, Roto, option D, all of the above. So the correct answer is option A, Diasna. Diasna granulator has a drying facility inbuilt. It is used for wet granulation process. So certain things like equipment है या कोई machineries है तो उनके जो specific points होते हैं या उनके नाम होते हैं जो किस purpose के लिए use होते हैं तो you guys have to remember. There is nothing to explain. Other granulators used for wet granulation are little pod, loading mixture, little pod, MGT, gral mixture, granulator, fluid bed granulator. Move on to the next question. Which of the following is not an example of antioxidant? Option A, sodium metasulfite. Option B, propyl gallate. Option C, tartrazine. Option D, ascorbic acid. So the correct answer is option C, tartrazine. Commonly used antioxidants are vitamin C, that is ascorbic acid, vitamin E, that is tocopherol, carotenoids, lutein, sulfite, phthalates, etc. While tartrazine is a coloring agent. So you guys have to remember कि कौन सा coloring agent है, कौन सा antioxidant है, कौन सा preservative है. Antioxidant basically help to prevent the oxidation of active pharmaceutical ingredient because of the environmental oxygen. Oxidation अगर नहीं होगा तो deterioration नहीं होगा. If deterioration नहीं होगा तो then the drug is good to use. Next question, how many tablets require for the content uniformity and weight variation test respectively? So the options are option A 10, 20, option B 20, 30, option C 30, 20, option D 20, 10. So the correct answer is option C 30, 20. Tablet required for content uniformity are 30, tablet required for weight variation are 20. So test for tablet, I have added this part as an additional part because you have to remember कि कौन से quality control test tablets के लिए perform किए जाते हैं. And this is very much important as per GPAT as well as NIPER. The official test is disintegration test, dissolution test, weight variation test, and drug content test. The non-official tests are organoleptic properties, color, odor test, etc. Stability test, hardness test, thickness test. Now let's move on to the next question. Which test is not applicable for multivitamins tablet? Option A, weight variation. Option B, content variation. Option C, dissolution. Option D, all of the above. So the correct answer is option B, content variation. Content variation test, it is only applicable to the tablet that contain less than 10 milligram or less than 10% weight of the active ingredient. It is not applicable for the tablet containing multivitamin or trace element. So the next question, the hardness for the extended release tablet is option A, 0 to 2.5 kilogram per centimeter square. Option B, 2.5 to 5 kilogram per centimeter square. Option C, 5 to 7.5 kilogram per centimeter square. Option D, more than 15 kilogram per centimeter square. The correct answer is 5 to 7.5 kilogram per centimeter square. हार्डनेस डिफाइन एज अ टैबलेट क्रशिंग स्ट्रेन. बेसिकली एक टैबलेट को क्रश करने के लिए कितना प्रेशर रिक्वायर होता है, कितना फोर्स रिक्वायर होता है, उसको मेजर करने के लिए हार्डनेस टेस्ट परफॉर्म करी जाती है. It is a force required to break a tablet to withstand mechanical shock during manufacturing, packaging और shipping. So manufacturing, packaging और shipping में chances हो सकते हैं कि टैबलेट टूट सकती है. पहले ये टेस्ट परफॉर्म करी जाती है, फिर उसका पैकेजिंग शिपिंग होती है. बिकॉज अगर एक क्रश टैबलेट है तो ऐसे टैबलेट डिस्कार्ड किए जाते हैं एंड इट विल नॉट बी एक्सेप्टेड बाय द कस्टमर्स. लिमिट, चुएबल्स टैबलेट की लिमिट होती है हार्डनेस की 2.25 टू 2.5 किलोग्राम पर सेंटीमीटर स्क्वायर. एज वी कैन अंडरस्टैंड कि इसकी हार्डनेस लिमिट हमेशा कम होगी बिकॉज ये चुएबल टैबलेट्स है. अगर इसकी हार्डनेस एकदम ज्यादा हो सकती तो इट विल बी इम्पॉसिबल फॉर अस टू च्यू एंड swallow. So for conventional, it is 2.5 to 5 kilogram per centimeter square. For extended release, the hardness strength is 5 to 7.5 kilogram per centimeter square. And this is the answer of our question. That is option C. Next question, which one of the following is responsible for the shape and size of tablet? Option A, hopper. Option B, upper punch. Option C, lower punch. Option D, die. So the correct answer is option D, die. Dies are responsible for the shape and size of the tablet. Let's understand the solution. Die, a component used in the conjunction with the upper and lower punches. It accepts the product for the compaction and is responsible for the tablet perimeter size and configuration. So here on the screen you can see that this is the upper punch and this is the lower punch and this is the die. यहाँ पे I found an amazing GIF, so I have added this. So here you can see that कि कैसे ये पाउडर मटेरियल यहाँ पे डाला जाता है. उसके बाद अपर एंड लोअर पंच उसको प्रेस करते हैं और जो डाई का शेप होगा वो शेप टैबलेट कैरी करेगी. दैट इज स्क्वायर, लाइक नॉट स्क्वायर बट रेक्टेंगुलर, सर्कुलर एक्सेट्रा, ओवल वगैरह, ओवल्स सर्कुलर. तो हियर यू कैन सी दैट द जीआईएफ की कैसे टैबलेट प्रिपेयर होके आ रही है. कि यहाँ पे ये मटेरियल फीडर है, ये फीडर से अपने का ये ऑरेंज कलर का मटेरियल डाला जा रहा है डाइस के अंदर. अपर लोअर पंच, अपर पंच एंड लोअर पंच प्रेशर के साथ उसको प्रेस कर रहे हैं, कंप्रेशन हो रहा है टैबलेट का. एंड हियर यू कैन सी दैट द ऑरेंज कलर टैबलेट्स आर प्रिपेयर. सो ये कंप्रेशन रोल है, सो जो प्रेशर दे रहे. सो द बेसिकली दैट इज हाउ टैबलेट्स आर मैन्युफैक्चर. That's it for today. Thank you for your kind attention.